Hiya, it's Nero Pensioner here. Those of you who have watched any of my previous videos may notice that I'm in a different location today. This is the cabin. We had this built for my wife as a crafting space. Unfortunately, she never really got to use it, but it's a lovely space and in a beautiful location, and it's nice to just come in and spend some time here. It backs onto railway lines, so we may hear the odd train going past, but they're all electrified these days, so to be honest, they don't really make much noise. We never really notice them. So today I'm going to talk about something quite different. I'm going to talk about prostate cancer. I was diagnosed with prostate cancer about 8 years ago. I was living in France at the time. I'll tell you a bit about that in a moment, but the reason that I'm doing this today is basically about 2 years ago, we retired and moved to this lovely place where we are now. And I changed hospitals for my treatment. And the hospital that I use now has a Maggie centre attached to it, just close by. Beautiful, beautiful place. And just purely by chance, I went along there one day. It's not the kind of thing that I normally do. I'm just a guy who just kind of gets on with stuff, and just does it. I've never really been, one for getting involved in, groups and things like that. But I had some time to spare one day when I was getting a scan, and I popped along to the Maggie Centre while I was waiting. And what an amazing place. I have to say, I couldn't recommend it more highly. It's a beautiful building for a start. They usually always are. They're amazing architects design some of them. And they are stunning buildings and staffed by amazing people, volunteers and paid staff who are just amazing, very knowledgeable and helpful. Anyway, I went along to the Maggie Centre, decided I really quite liked the look of the place, and so signed myself up to go to a prostate cancer group that they do there, and went along to that, and so met lots of other guys that had prostate cancer. And what was interesting, I think, was how each of our experiences is different. Our experience of prostate cancer, and indeed our experience of treatment, and how side effects affect us, and so on. And I'm going to talk about that in a while. But what I kind of found, is that it's actually quite useful to talk to other people in a similar position. That we're able to offer each other advice about how to cope with side effects and things like that. And just hearing that other people, I think, are going through similar things is often quite useful too. So anyway, that's why I'm doing this video today. So I'm going to share my prostate cancer story. This is my personal perspective. As I say, it's different for everyone. There are differences and similarities in how prostate cancer affects people. But from my perspective, I was diagnosed 8 years ago, roundabout, and unfortunately it should have been 9. And I'll just explain that quickly because that's quite relevant too. About 9 years ago, living in France, I was having quite severe abdominal pain, and it was awful. It was really severe. I've never felt pain like it. I went to the doctor, and they tried various IBS stuff and things, none of which was effective. I didn't expect it to be. I was pretty certain that it wasn't any kind of gastric thing. But I'm still, to this day, I don't know what it is. It still affects me, and I don't know what it is. But as part of the doctor's investigation, I had a blood test. And in France, the way that the health service works, your medical records are yours. So if you go for an X-ray or a scan or whatever, you get handed the X-ray in an envelope to take to whoever it is you're going to see about it. And likewise with scans, you'll get the CD with the scans on and stuff. And in terms of the blood test, I got the results that came to me in the post to my home. By the time they came, the way that these pains affect me is I have 3 or 4 days or nights usually when I'm in pretty severe pain. And then it passes and I'll go for a couple of months maybe before it affects me again. And it had stopped, so the pain had stopped. So I opened the blood test, had a quick glance at it. Everything looked fine, put it back in the envelope and filed it with my medical records. Then it was about a year later, so this is now 8 years ago, I had the abdominal pains were back and they were excruciating. I went back to the doctor and I had another blood test. When that blood test came through, I opened it up and looked at it. And there on the front page, it was a highlighted column, which was PSA, and it showed the PSA of 22.8. PSA, for those of you who don't know, it's a prostate-specific antigen, and the level of that you have in your body can be a guide to whether or not you have prostate cancer. It's not definitive, and the actual level seems to vary wildly. Some people can have quite high levels and the prostate cancer being an early stage and vice versa. And so, but anyway, the PSA was highlighted and it was at 22.8. Now the norm is normally when it goes over 4, you would be called in. They'd start investigating you for prostate cancer. It's just another train going past. So anyway, mine was at 22.8, but there in the column, it had a little comparison to the previous blood test, which showed that the previous blood test had been 4.8, which kind of took me aback a bit. So I went and looked for the previous blood test and got it out and discovered that what I hadn't realised is it was a double-sided page, and on the reverse side there was the PSA highlighted at 4.8, highlighted because it was above an acceptable level. And I hadn't realised that, and I'd missed it. So basically 12 months had elapsed when my PSA had gone from approximately 4.8 to 22.8, and obviously the cancer had continued to grow and spread in that time. Now, if it had been picked up that year earlier, it may have been a very different matter, and that's why I'm going to say at this point it is very important for you men who are of a certain age, 50ish or over, get yourself tested regularly. It can be a PSA test. It's fine. You don't have to worry about the digital rectal exam or anything like that in the first instance, anyway. But it can be a PSA test. Just keep getting yourself tested regularly, because the sooner it's picked up, the better it is. Obviously, when I was diagnosed, I told all my friends, all of my male family members who were of that kind of age, get yourself tested. One friend, one family member, both found to have early stages prostate cancer, both been treated, in remission. And if it gets caught early, great. It can be dealt with very effectively. Unfortunately for me, that early stage was missed, and so my PSA was high, and I'd had 12 more months. So I was sent obviously to an oncologist, stroke urologist, and had various tests, MRI tests, CT scan, biopsies, of course. and so on. And yeah, it was discovered that the prostate cancer was actually outside of my prostate. It was in my lymphatic system, and just a few nodes. So those nodes were removed. The biopsy, they took 35 samples, 28 of which were positive, and the majority of those were grade 4. So the treatment that was prescribed for me then was, I had 35 fractions of radiotherapy. So that's 1 fraction per day for 35 days. It's spread over 7 weeks, 5 days a week for 7 weeks. You get a couple of days over the weekend to kind of allow yourself and your body to recover from the previous 5 days of radiotherapy. I think radiotherapy was kind of okay for me. I had quite a distance to travel to the radiotherapy centre. So it was quite onerous and quite tiring. By the end of the 35 fractions, I was pretty exhausted, to be honest. I had a little bit of burning I could feel in my skin, and there was a bit of collateral damage which kind of manifested itself later on in terms of issues with bowel and stuff like that. But that healed, which is fine. So following the radiotherapy, I was put on hormone therapy, hormone injections for 3 years. I started that treatment in France, and then in the interim moved back to the UK, and it was continued here in Scotland. My experience with the hormone therapy was kind of a bit different. I struggled with it, to be honest. There were the side effects that we can all read about. There was erectile dysfunction, genital shrinking, there was loss of libido, loss of bodily hair. I got more emotional. But the one thing that affected me quite badly was fatigue. I was quite a physical person. I did a lot of physical stuff. Always have done. I've lived in rural locations most of my life, and I kind of do stuff. I did hill walking, climbing. I all sorts of stuff like that. That was my thing. But I did lots of stuff around the house and things as well. I enjoyed working physically. And I found myself less and less able to do that. And what was bad was it was progressive. It, for the 3 years, it got worse and worse and worse. I got weaker and weaker. Yeah, it never reached like a level and stayed there. It just, kept going. So that I struggled with that more than anything else. All the other, side effects, the sexual ones, for want of a better phrase, I was kind of okay with, and thankfully my lovely wife was too. She was wonderful, but the fatigue was tough. But it was effective. My PSA, after the first couple of months of being on hormone therapy, my PSA was like 0, and it was undetectable, and it stayed like that through those 3 years. At the end of the 3 years, the hormone therapy obviously stopped, and I was back here in Scotland by that time, and it was probably about 18 months or so before the PSA started rising again. And then it got itself up to, I was getting PSA tests every 3 months. I had one that was just under 2, it's about 1.9 or something like that. And there was basically if you have a history of prostate cancer, it seems to be the thing that when it goes above 2, you then get referred back again. So I had one test, I say it was about 1.9. Then 3 months later I went for another one that was 5.6. So I got referred back to oncology, and I got put back on the hormone therapy. And alongside that, I was given another therapy which is called enzalutamide, which is a tablet that you take at home, 4 tablets daily. Now, the unfortunate thing about this is that in the 18 months between the hormone therapy ending and then it starting again, I never really recovered. There are a few things improved, but not very much, I have to say. So when I went back onto the hormone therapy, I was actually starting from a much lower base, and so the fatigue sort of kicked off again, but from a lower base, and kept going and has kept going down ever since. Even today, I notice. When I take my wife's dog for a walk, we have a few circuits that we do, and I find them more and more difficult every time I do them. Some of them I can't do anymore. The ones that I've got inclines in them, I just can't do it. I have to kind of stick on the flat. So, but that's one thing. But I found on this second lot of therapy, that the thing that really affected me here, even more so than the fatigue, was the cognitive functioning. My memory is just absolutely abysmal now, and my that's my bad memory. My concentration is dreadful. I can't concentrate on anything. I forget what I'm doing from 1 minute to the next. It's pretty bad, really. And that has been quite distressing, shall we say. It wasn't too bad when my wife was around, because she could remind me about stuff and things. But now that I'm on my own, it's quite a concern. I find myself in an evening and stuff desperately trying to remember whether I remember to feed the dog or not. I found his water bowl empty, things like that. So it's quite worrying. Anyway, I spoke to one of the staff at the Maggie Centre about it, very lovely lady there, and she suggested that I speak to my consultant. Now, what's been happening for the past, since I went back on the hormone therapy, really, is I've been getting a telephone consultation monthly. But what she suggested is that I ask for a face-to-face. So I did, and I went and spoke to the consultant. Now, she was also very lovely, and we discussed it, and we decided to stop the enzalutamide. So I did that. I did that about a month ago, and I think, sorry, excuse me. I think that the cognitive impairment is less. I think things have improved a little, but only a little. On the day that I had the appointment with the consultant, the following day I was due to have my hormone injection, and the way that works is that I have to order the product through the pharmacy and pick it up, and then take it to the doctor's surgery where the nurse injects it. So I'd already done that, so I already had the product. So we decided to go ahead with that injection, which is probably a good idea anyway, just to see whether coming off with the enzalutamide would be enough in itself. My feeling is it's not, and it won't be. I think I probably want to stop the hormone therapy as well. The thing is, as I see it, that it's not just about length of life. That the effectiveness of the hormone therapy is very effective. But that will eventually stop. It will lose its effectiveness. Anyway, and then the only thing that's left to me is chemotherapy, which I'm not really sure I even want to consider. Yeah, I think quality of life is important, and I would rather have a good quality of life that I can spend and do activities with my grandchildren and stuff for a few years than live for, I don't know, 5, 8, 10 years like an invalid. So that's kind of where I'm at the moment. I have this next appointment, and I'll discuss it with the consultant then, and we'll see what happens, and I'll probably do another wee video just if anyone's interested, to let you know how it's going. But the important thing is, I just wanted to share this. Hopefully some people will see it. I don't know how these things work on YouTube, to be honest. I'm really surprised. I've got nearly 100 subscribers on my channel. I mean, I know it's a pitiful amount, really, but I'm not in it for trying to monetize things or anything. I just like to share information, and that's what I'm trying to do here. And if you're a guy in your 50s or whatever, make sure you get tested and get tested regularly. If you have family who are affected by cancer, any cancer, not just prostate cancer, any cancer, and you have a Maggie's centre nearby, you get along there. Really, even if you're not the victim of cancer yourself, you're not a cancer sufferer yourself, if you have a family of someone that, they are so helpful and so knowledgeable. Couldn't recommend them more highly. So anyway, thank you very much for watching this video, if you have done. And I'll post again, and have a good day. Bye for now.